hours, or you had fun with your friends over the weekend, or you had to work over the weekend and it was a long, stressful weekend. So what we got to do when we're looking at whatever condition it is, whether it's neck pain, headaches, low back pain, we got to figure out what you're doing outside of the clinic and hopefully try and, you know, limit some of those things or change some of those things. So what we're going to do tonight is I want you guys to get a thorough understanding for back pain, what causes back pain, and how you can actually stop it. So here's our equation, guys. We have a three-legged stool. Has anybody ever tried to sit on a two-legged stool? Or a one-legged stool?
It's hard.
Was it hard?
No. We used to use them to milk cows. Oh man, oh man.
So as long as you got a cow to hold on to, you're okay. If you don't, you need three legs, okay? So here's our equation. The adjustment. The adjustment's super important, okay? And we need adjustments in rhythm if we actually want to start the healing process and break the cycle that's going on. So when you miss your appointments, we get a little upset because we don't want to break that rhythm. We have a course of action and we need to stay on that. The other thing is we need to break our bad habits, okay? So like I said, we need to figure out what you're doing outside the clinic and we need to stop doing that. Or maybe change how we're doing things. And then we need specific exercises to strengthen the spine. And we're going to talk about all of this tonight. So how bad is it? How bad is back pain? Many of you in here either experience back pain or have experienced back pain, and it can be pretty bad, right? And if you know somebody that's had really bad back pain, they don't live with back pain, they live around back pain. Okay, so it literally controls their life, and they have to try and manage it. And if you can't tie your shoes, if you can't bend over and tie your shoes in the morning, I mean, how much tolerance are you going to have with your kids? How good of a spouse are you going to be? So, I mean, it is a big deal. And 80% of Americans are going to experience back pain at some point in their life. And the majority of those people, it's going to turn into a chronic condition. Meaning it's going to keep on resurfacing, or they're going to be dealing with it for the rest of their life. We don't want that to be you guys. So, low back pain. It is the number 3 reason that you'd see a medical doctor aside from joint pain, so they kind of fall in the same category. It's the number 1 reason you're going to see a chiropractor. Unfortunately, because there's way more benefits to chiropractic than low back pain, but that's the truth. And it is the 2nd reason why people miss days at work, okay? Only next to the common cold or the flu or some type of illness like that. So there's a huge economic burden there too. And it is the number 1 cause of disability worldwide. So it's a big issue. It's bad. And it's the number 1 reason for prescribed opiates, okay? Which we have an opioid problem, right? And our opioid problem has turned into a heroin problem, right? And just to bring that to life, I want Heather, she's got a few stats to read as far as opioids go and how big of an issue it really is.
Okay, give me a sec here. I have to organize my stats.
Or I can read it.
No, so, right here.
Yep.
Okay, so drug overdose is the leading cause of accidental death in the U.S. with 47,055, so 47,055 lethal drug overdoses in 2014, okay? Opioid addiction is driving the epidemic with 18,893, so almost 19,000 overdose deaths related to prescription pain relievers and 10,500 overdose deaths related to heroin, just in 2014. So, I mean, there's been more deaths because of opioid overdose than there has been of heroin, but it's starting to climb, and because people can get heroin a lot cheaper than they can get prescription drugs.
Really?
Yeah.
Oh my gosh.
So,
That's really sad.
Here's some more.
okay, so in 2012, 259 million prescriptions were written for opioids, which is more than enough to give every single American adult their own bottle of pills. Crazy. 4 in 5 new heroin users started out misusing prescription painkillers. So as a consequence, the rate of heroin overdose deaths nearly quadrupled from 2000 to 2013. During the 14-year period, the rate of heroin overdose showed an average increase of 6% per year from 2000 to 2010, followed by a larger average increase of 37% per year from 2010 to 2013. 94% of respondents in a 2014 survey of people in treatment for opioid addiction said they chose to use heroin because prescription opioids were far more expensive and harder to obtain. So this is turning into a major heroin problem and a major drug problem because opioids get people hooked and they're so overly prescribed. So that's a major issue.
So a little more than possibly a back problem, right? So it's bad. So first of all, if we're going to understand back pain, we have to understand a little bit about the spine. Imagine that. So here's the thing. When we're born, we are born with just this C-shaped curve in our spine. Okay, this is kind of how we're in the womb. And as
It's a lot smaller. This is
A lot
a 6-foot male.
a lot smaller. And then over time, as we're an infant, we start to gain a little bit of head control, right? And so this baby's going to pick up their head, and they're going to start developing a curve in their neck. And they're going to start developing postural muscles in their neck. And the development of those postural muscles in the neck is going to set the tone for the entire spine. So you hear us tell all of our parents in the clinic when their kiddos are infants, we really, really push tummy time, okay? We want to develop this beautiful cervical curve, and it's going to make an impact on the rest of the spine. So as this kid gets a little bit older, they become mobile, right? So pelvis rocks forward, they drop that belly down, and they start to develop a lumbar curve, and they start crawling around, okay? So that's how we get our curves. And when they reach about 1, they become upright, and they help promote these curves, okay? So when we're talking to our patients in the clinic, we want these kiddos crawling for at least 4 months, okay? We want them on their belly crawling because that's how they develop that lumbar curve. Super duper important. We want them to develop this cervical curve because it's super duper important, okay? And then once they're upright, we want to keep them upright because this is what reinforces those curves. So we don't want to give a kid an iPad where they have to look down at and, possibly we'd have to retrain those postural muscles in the spine, okay? We don't want them sitting in a chair in school for hours on end, okay? We just gain these curves, we want to promote those. So, we want our kids upright, moving around, playing, raising heck, right? Okay, when we look at the spine, it's not just a series of bones, okay? It's a series of discs, there's a series of soft tissue, and if we look at the spine, we have nerves that exit on each side, okay, between each vertebral segment, and we have a disc that separates each bone, okay? So we got a bone, then a disc, then a bone, then a disc. That disc, most people think is a shock absorber, okay? It's actually a spacer, so that disc is there to separate these vertebrae so those nerves have a place to go. As long as we have this curve, those discs are going to stay healthy, okay? Because it's this very curve that absorbs the shock. This is a big giant spring, super duper important. Just whistling at me. No, you're fine. Anyways, it's this series of curves that literally acts as a spring for the spine, okay? And what we're doing here is we're loading these back joints here that have a ton of receptors in them. And when we load those joints, we actually stimulate the brain. So a lot of you have heard us say that 90% of stimulation and nutrition to the brain comes from movement of the spine. And it's because of those receptors in the back portion of the spine. So it's super important that we have these curves so those get compressed. Now, if we lose these curves from traumas, bad habits, both, sitting all day, this is what happens. We put all of the stress on the front portion of the spine and we stress those discs. So we go throughout our life, 5, 10, 15 years down the road, and we're going to wear those discs out, okay? We wear those discs out, what's going to happen is we're going to eventually irritate those nerves that are actually there. We don't want that to happen, okay? So we want a nice, pretty looking spine that has these curves here. We want a straight spine this way, okay? Straight is strong. If you got any curves going one way or the other, this spine is not a strong spine, okay? We axial load this spine, and it has the potential to fail. It has the potential to irritate and tear certain tissues, and it's going to irritate the nervous system, okay? So you got to understand that basic anatomy when we're talking about the back. And a lot of this is going to make it a lot more sense.
Any questions on that?
Now, if
I have a question.
sure.
I've heard of people having discs fused together. What does that do to those nerves? And
You mean artificially fused by like a surgeon?
Yeah.
Okay.
Okay, so there's still going to be a patency there. There's still going to be room for a nerve because they're not going to block that off. But we move out, or we lose out on motion, and we're going to lose out on the compression of those posterior joints, which we'll talk about later, which can turn into an issue. So if we have an issue with this spine, most of you experience this, right? Low back pain, tight muscles, lost range of motion, stiffness, leg pain, swelling, burning, and the ever famous sciatica, right? I love this when new patients come in, they try and say this word because they Googled it, and it's funny what you come up with. They all got it, it's like they caught it like the flu or something. So. But anyways, this is one of the most common things that we see in the clinic. And what is sciatica? It is simply just irritation of the sciatic nerve. So we got this big nerve running down the back of our leg about the size of our thumb, okay? One of the biggest nerves in the body. And what it is it's actually the union of multiple nerves, okay? So we got a bunch of nerves coming out of the low back, and we got a bunch of nerves coming out of this tailbone. So we got nerves coming out of the lumbar spine, nerves coming out of the sacrum, and a large portion of those nerves, they're going to join together and form the sciatic nerve. Okay? And many people, when they have sciatica or they have irritation of that nerve, they just assume that it's a leg problem. It's not a leg problem, the problem's higher up. It's in the back. So it's where those nerves originate. Okay? The thing is what people don't realize is it's not just a leg problem, it's not just a numbness and tingling in your butt problem, it's a health problem, okay? Because if we have an L5 nerve that's being irritated and it's going to join and form the sciatic nerve, it makes a few more branches before it does that. So it's going to supply things like your intestines, maybe your prostate, your genitals, all kinds of things. So you could have other issues as well, okay? So we need to remember, not just a leg problem, could be something deeper. And what comes along with sciatica? The most common thing that we're going to see with this is what we call a herniation. Okay, so between each bone, like we said, we got a disc. And one of the most common conditions we see in the clinic is a disc herniation. So with a disc herniation, all it is it's a tissue that's in a space where it doesn't belong. So if I have a hiatal hernia, that's just a tissue in a spot that it doesn't belong. If I have an inguinal hernia, same thing. Exact same thing for the discs within your spine. I want to kind of orient you so you know a little bit of anatomy when we're talking about this. So as far as the disc goes, we have this outer ring called the annulus fibrosus. And it's really fibrous, it's a pretty tough tissue, and it's in a circular fashion. So they called it the annulus fibrosus. And in the center of that, this big old thing here, we call that the nucleus pulposus. And it's just a jelly-filled, almost like ball bearing that the spine can kind of move around. Okay? I want you to picture that as like a jelly donut, okay? That's really kind of the consistency we're talking about. What happens when we have a disc herniation is we actually have tears in the annulus fibrosus, okay? So that outer ring. So if we're constantly doing a motion that's stressing the disc, day in, day out, we're going to create little tears in that thing. Eventually, we're going to hit a point where we create enough tears to where that nucleus pulposus can push through, okay? And it's going to create a lot of swelling, a lot of inflammation, and we have a tissue in a spot where it's not supposed to be. The most common place where we see that is right where this nerve comes out, okay? So just like if we're talking about water or we're talking about air, things like to flow to the area of least resistance, right? So same thing in the body. There's a space there, so that's where we're going to see the herniation, and that's where we're going to get nerve irritation. So any idea, I kind of gave you a hint, any idea how we get these disc herniations?
Picking up heavy things.
Yeah. So, that's a good point. And what's the most common position you think that could happen in?
Straight legs, bending down.
So, the traditional low back injury, where we're getting it, is when we're bending at the back, we're leaning to one side, and we're rotating. So, picking something up, right?
Yeah.
So, some people may do that day to day as their job, right? They're doing this all day. And they may be completely, totally asymptomatic, and then they're at home one day, and they pick up a dryer out of the dryer sheet, and all of a sudden they're on their knees. What has happened is this thing finally gave way, or they've had a disc herniation there, and there's finally enough inflammation to actually put pressure on that nerve. So we could take MRIs of many of you in this room, and you might not have back pain, but about half of you guys would show a disc herniation on an MRI. Okay? And like we said, what creates this is traumas. Okay? You can have a major trauma, a car accident or whatever, that could jar the spine, tear these fibers. It could be repetitive little traumas. We see that, like maybe the fun weekend and that guy on the stairs. Or bad habits. Okay? And that's typically what we see. Now, what else do traumas, bad habits, or a combination of both cause? See how well we did at educating you guys as patients.
Oh.
Anybody ever heard this word? A
Subluxation.
subluxation.
Oh,
Okay,
subluxation.
a subluxation and a disc herniation, they go together, okay? You can't have a disc herniation if you don't have a disturbance in the biomechanics of the joint. Okay, so we either got to put that disc in a stress position and continue to do that over and over again, or we got to have a misalignment there that's chronically putting stress on that disc. Okay, now if we look at the standard for an orthopedic text in grad school, it's called Evans Text of Orthopedics. We had the same one in chiropractic school. And they say that the research supports that 90% of low back pain is mechanical in nature, just meaning motion and alignment. So us in the medical profession, we're in agreement on what the problem is, except for we have a name for it and we have a way to correct it. Okay? And we're going to talk about that. So when we have a subluxation, literally all it is, guys, is we got a misalignment of the spinal joint. Okay? It's going to create soft tissue damage, so we're damaging the disc. We're damaging other tissues around the spine. It's going to create inflammation and swelling, which is going to irritate the nerves that exit the spine. Okay? Is the body smart or stupid? Thank you. Okay, so if we have a misaligned joint that's causing tissue damage and inflammation, what do you think the body's going to do?
Shut.
What's that?
Shut down.
Yeah, one thing it's going to do is hopefully it's going to let you know. So there's going to come a point where we're going to have some pain, and it's. Do you think we should just shut that off?
No.
There's an open ring. Okay, so that's the body saying, hey, dummy, don't do that. Move this way. Hey, don't do that. It's telling you what you can and can't do and where you're irritating that tissue. The other thing it's going to do is it's going to try and stabilize that spot, right? So the primary function of a muscle is to actually move a joint, to act as a mover. The secondary function is to act as a strap or stabilizer. Okay, so when we have a muscle spasm and we have excruciating back pain, might not be the best idea to actually try and reduce that spasm. Okay, that spasm is holding that joint in a position so we don't continue to do damage. And that pain is telling us what we can and can't do and when we're creating more damage. So we need to be a little bit better at listening to our body. When we talked about the disc, I failed to mention that the disc has a very poor blood supply. Okay, it only has a good blood supply around the periphery, so the very, very edges of the disc. So we count on nutrients to the disc from a pumping and sucking effect. Okay, so we constantly push fluid out of the disc, and when we walk, we're going to kind of do one of these actions. So we push tissue or inflammation and proteins and water out of the disc, and then with that normal walking motion, we're going to suck nutrients back in. So we're constantly sucking and pumping stuff out of the disc.
Before you get too far, back in 1980, I ended up spraining my back.
Mhm.
Now, what I was told by my chiropractor is you have the discs, he said vertebrae. Aren't vertebrae more in your neck and shoulders? Or is
So-
the vertebrae clear down?
So each one of these is a vertebra. So
It's the name of the bone in your back. Every bone in your back is called a
Okay,
vertebrae.
and then he said there's little ligaments around those.
Lots of
And he
There's a
said
ton
what
of
I
them.
had done, I was a custodian and I was emptying paper towel box. Okay, put them up on a shelf, bend over. And I turned around to pick up the empty box and I couldn't stand up straight. And I was 3 weeks on my stomach. I mean, he did the adjustment and everything. I never went to therapy or anything. But I was 3 weeks getting that healed with ice and everything else. And ever since I sprained those ligaments, if I overextend, I'll get that. I'll get that sprain to where I have to constantly put ice on it.
right, and when we have tissue damage, let's say we tear a ligament or we injure a disc, how's the body going to heal? It's going to be with scar tissue, right? So it's
Yeah.
going to be with a cheaper, more fibrotic tissue. So that thing's going to be prone to injury down the road, and you're
Right.
always going to have a weak link there. So we
Okay.
need to do whatever we can to protect that area of your spine.
So the vertebrae are along with the discs.
Yep, each one of these bones
Those are the
are
vertebrae.
vertebrae.
Okay.
Every bone you
That
see
makes
here,
sense.
except for these and this.
Okay.
So, what we call that pumping and sucking effect is imbibition. So here's the problem with the muscle spasm. It's good short term, but if we keep that muscle spasm there, what we actually do is we start changing the histology or the makeup of that muscle. So the fact that it has become a stabilizer and a strap, the body's going to keep it in that function if we continue to have a wobbly, unstable joint. Okay? So it's going to take on more of the role of a tendon. And if we lose the function of that muscle, we're going to start losing out on that imbibition or that sucking and pumping effect that keeps that disc nice and healthy. When that happens, we're also going to start bringing in fibrotic tissue to the actual joint itself, and we develop what we call an adhesion. Okay, so what we have here is we have a misaligned joint that's swollen, causing nerve irritation, and it's stuck in that position. Okay, and we talked about how movement of the spine and those posterior joints, when we compress those, we get a signal to the brain. When we lose out on that, what it does is it actually puts us in a chronic stress physiology. Okay. And what I mean by that is it puts us in a sympathetic nervous system state. So it actually activates the stress response in the brain. We're going to start churning out things like cortisol, and it's going to lead to things like decreased immunity and a whole other slew of issues. So just that movement of the spine is important. It's literally like wind to a windmill, okay? It's going to act as nutrition and stimulation. So once again, this is not just a back problem, it is a health problem.
Okay, so I have a question.
Shoot.
And I'm sure you'll get to this, so I'm sorry if I jump ahead. So what is the best kind of movement for the spine?
We'll talk about that.
Okay.
You're on it,
But
Randy.
here's the thing, I do want to preface this with a bunch of things, because we figure out if you guys know more about your body, you're going to treat it a little better, and all this stuff's going to make a lot more sense. Okay? And then once again, why we actually care about the spine, it's because of this nervous system, okay? And like we said, when we have a pinched nerve that's causing us leg pain, we got to remember those nerves go to other areas of the body. So we want to make sure that we have a proper nerve supply. The other thing is, I talked about we could take an MRI at everybody in this room, and half of you might have a disc herniation, and half of you might have nerve irritation and nerve pressure without even feeling anything. And that's because less than 10% of our nervous system and our nerves actually sense pain. So there's multiple different families of functions of nerves. Some of them are responsible for moving things. Some of them have an autonomic function. Some of them are trophic in nature, just meaning nutrition supply. Okay, so just because we don't have pain doesn't mean that there's not a problem. And just because somebody doesn't have pain doesn't mean that they don't have a serious back problem. Okay, we could have a herniation, we could have a subluxation sitting there just waiting to wreak havoc. So this is what we're looking for when we assess your spine, guys. This picture that you see on the left, this is textbook normal. So we got a beautiful curve here, and each one of these discs is nice and juicy and fat. It's like a big old thick cut of filet mignon, okay? That's what I want you to picture that healthy disc as. Now, when we look here, we notice that this spine, if we look at this disc, it's essentially not there, and this disc essentially isn't there either. The reason being is we have had a mechanical disturbance there for a really long time. And we have lost that normal sucking and pumping effect, so instead of having filet mignon, we got a piece of beef jerky. Okay? And that's literally what's going on with the tissue. It's dried out, and it's just going to continue to tear and continue to have wear and tear on it. And you can see that these segments actually are not lined up, depicted by the red lines. If we take an MRI of this person, this is what we get. So we got this big old disc herniation pushing back into our neural canal and putting a ton of pressure on the nerve system.
So I have a question.
Yep.
How easy is it to repair those cushiony spots? Because I've been told that it can be irreversible. Is that true? If it's then turned to beef jerky, can you rehydrate it and make
so
it
what we
a
want to do is
filet mignon?
we want to put motion back in that joint. We want to correct the misalignment that's there. But whatever damage and degeneration has occurred there, unfortunately that is there. We can't put that disc material back. However, if there is a herniation, there is a chance that it could actually be reduced. Okay? So this is actually a case study from a colleague. This picture on the right, he has one of those disc herniations. Okay? And he already had surgery. And then he came into my colleague's office, and this is a year after care. So he decided, they want to do a second surgery. He said, no, I'm not going to go that route. I'm going to try something different. So after a year's worth of care, you can see that this disc is completely rehydrated. Now we look at the width of that disc, I mean it's still the same, okay? Whatever degeneration happened there happened. But as far as that herniation, they were able to reduce that nuclear material just simply by improving the mechanics and the alignment of that vertebra. And this was through specific Gonstead chiropractic care, which is what we practice. So if anybody ever asks you what's different about our clinic, it's that we're specific, okay? We always know what bone we're on and which way we're moving it. And the technique that we use is called Gonstead. Now, a quick point on that, because we get this a lot, guys. There's really two types of care out there when we're talking about chiropractic. There's palliative care, where, doc, my neck hurts, I want you to adjust me here and I'll come back when it hurts again. And then there's corrective care. We're actually trying to correct the mechanical issue in your spine, okay? Corrective care is what we focus on here. So nothing against palliative care, it has its place, but we just don't practice that way. So I know docs are all different. But let's look at the allopathic or the medical route. So when we have lower back pain, what do they suggest? And I've heard this numerous times from, let's say, urgent care. They'll tell them, put some heat on it, get some rest. Macy's shaking her head.
Yeah, I've been told that. I'm like, no. Heat on inflammation doesn't make sense to me.
There you go. Perfect.
Nice.
Yeah, you might as well grab a noose and go in the closet, right?
That's what I want to do.
Well, and that's what's happening. So first of all, we have a muscle spasm, and heat might help with that muscle spasm because it's going to dilate the vessels and it can relax the muscle. But what it's going to do is it's going to dilate those blood vessels and draw more inflammatory products to the actual joint. Okay, so we're going to create more inflammation and more discomfort. And we just talked about, whenever we adjust, you guys, what do we tell you to do?
Drink lots of water.
Drink lots of water, and we usually want people walking.
And take
We
a
want you
walk.
upright, walking, moving, right?
Some people you tell to take a nap sometimes, if it's a bad adjustment. Not me, my kids, they're all Heather, sleeping.
Yeah,
She's
well,
going
that's a
nap.
different, yeah, when I give her a really big adjustment, I tell her, go rest your nerve system, go home, take a good snooze, but for the most part.
So there's a
I was like,
time and
you have
place.
never
like
told me
that
that.
Now, all these
too.
people want me to tell
I
them to
try to
take a
get mommy to
nap.
write me a note sometimes.
I take a power nap.
There's a time and place for the bed rest, but yeah, traditionally we want you moving, okay? We want to stimulate the motion in the spine. Drugs. Do drugs work, guys?
No, they
As a
just
Band-Aid.
mask-
Band-Aids, big
They
Band-Aids.
mask the pain, but they do work, right? If they give you a drug that says this is going to reduce your pain, most likely it's going to reduce your pain. If they give you a drug that says this is going to relax the muscles, most likely it's going to relax the muscles, right?
But temporarily.
Mm-hmm.
But
The only
temporarily.
While you're on
curable
them.
drug they have is penicillin. That
But,
gets rid of whatever you have.
but when we're talking about, let's say, muscle relaxers, do you guys think those are smart bombs? They know which muscles to relax?
I just relax all of them.
Okay, so could they relax the muscles in the eyes? And maybe you shouldn't be driving, and maybe that's why they have that warning. And what about the heart? Is the heart a muscle?
Yeah.
Okay. So they aren't just relaxing the stabilizers and muscles in the spine that are contracted. They're going to relax a lot of things. Okay. Same thing with pain medication. The other thing that really gets me is like the fast food medication. So we have a bunch of NSAIDs or non-steroidal anti-inflammatory drugs or Tylenol, and we all know the consequences of non-steroidal anti-inflammatory drugs and GI problems, right? They've made that pretty public as far as ulcers and GI bleeding. I mean, a serious issue. But what we don't realize, just snuggle up next to Shirley. She's nice.
There you
You're
go.
way out here, there.
I'll keep you warm.
Way back here. Way back.
Putting it in a pocket.
Just, there you go.
Thank you.
You're welcome.
But we don't realize some of the consequences of some of those over-the-counter drugs. So we pulled some research just on Tylenol, and Heather's going to tell you.
Because most people think Tylenol's safe, right? It's like the safest over-the-counter to use. We give it to our kids, right?
Yeah.
It's well-intentioned, right? We're not
Yeah.
trying to make anybody feel bad. It's well-intentioned, but we don't hear about the potential consequences.
Okay, so the title of this is Tylenol Overdose Risk is Staggering. Acetaminophen Safeguards Remain Insufficient. Okay, so acetaminophen, which is a fancy word for Tylenol, overdose sends as many as 78,000 Americans to the emergency room annually and results in 33 hospitalizations a year. Federal data shows that, okay? Acetaminophen is also the nation's leading cause of acute liver failure. The leading cause of acute liver failure, according to data from an ongoing study funded by the National Institute of Health. So that's 78,000 Americans a year go to the emergency room, and it's the leading cause of liver failure. Not alcohol, Tylenol. It's hard on our liver. It's really hard.
What the heck can a person
Rather you just
take
give me a beer, right?
to relieve pain?
That's your own little muscle
I go
relaxer.
between Tylenol and ibuprofen. If I get immune to one or the other, and there's temporary cures, and that's how I live my life.
Surely.
Sorry.
That's
Alcohol.
That's
So,
another subject, another day, I know.
We're gonna help you with a lot of that tonight, okay? Physical therapy, guys, we love physical therapy, and that's part of that three-legged stool, right? But if the main issue is a mechanical problem, we gotta correct the mechanical problem before we start working on the muscles, right? We're gonna correct that problem and then strengthen around the spine. Steroid injections. Once again, temporary fix, right? They usually last 3 to 4 months. But what we don't know is with those injections, I mean, they are a powerful anti-inflammatory, okay? So they push proteins out of the joint. What they also do is they damage the synovial lining within the joint, which is the very thing that produces the fluid in our joints. Not a good thing. That fluid is very, very important.
Now, are you talking drugs like cortisone or something like that? Okay.
Exactly. The other thing is it can change the histology of the tendons and the ligaments to where we decrease their tensile strength. So they're more prone to tear. Okay? Not a good thing. Pain management. I just hate that. I hate managing the pain. I don't feel like we should try and manage anything. We try and manage diabetes. We try and manage multiple conditions. And that just means, once again, you're living around the problem, okay? You don't want to just manage the pain.
Okay, but there are situations in
Yep.
which you have to function as an adult,
That's true.
especially when you are the provider
And
for small children,
Mhm.
and you have to make it through the day. What do you suggest?
Exactly. You're
Is
here.
this so hard? This question's hard because our family, like, we wouldn't be telling you guys this if we didn't live like this. Like, literally, my kids have never had a dosage of any drug in their body, and we, since going to chiropractic school, have never ever taken any sort of drug, any over the counters.
When are they old enough
so-
to have much pain?
Well, I know, but
They're
I mean, my
youngins.
kids are teething. You know, Quinn's getting teeth right now. I guarantee a lot of
Yeah.
moms use, you know, analgesic type medication for teething, but it's like,
Well, and see, and I'm with you. Like,
Yeah.
we try to do the homeopathic
hear
stuff
ya.
first, but there is a point in which I break.
I know.
We
I know.
understand that. We're not here to make you feel guilty.
No, we aren't.
No.
We
Is
understand
there-
too. The
but is
drugs
there
are there for a
another-
reason.
We understand.
Yeah.
Sometimes you need to get out of the fire.
Sanity's important.
Okay?
That's right.
But
And
you
we wanna know
gotta
what
you
to
gotta
do, too.
decide when that
You
is.
know.
But you also gotta know that it's not a cure,
Oh,
and
yeah.
it's never gonna fix the problem.
No.
Okay?
And really, we just want to raise the awareness of the problems too. So like, it's more for 'cause you guys we're preaching to the choir because you guys are the ones here and the ones that care. But it's the people that don't even think twice about taking
Yeah.
800 milligrams of this, and then as soon as that 4 hours hit, take it again but not even thinking what is this actually doing to my
We're
body.
doing that to their littles.
Yeah, exactly. So that's the real thing is we want you to just be aware.
And I'm not trying to be on the defense, but I wondered if there is something, like, if in our moving or something that you suggest other than taking, if you do have pain. That is kind of natural.
Causes less liver failure. than thyroid.
Yeah.
Is eat right and stay
Alfalfa,
active.
purple liver,
That's the
purple-
two things I've
purple
heard.
grape juice, and cod liver oil.
Because mine usually is like the lack of sleep and then the headache coming and that part
Yeah.
of me, and I'm like,
Find a way
But-
to get more sleep. Take naps.
Hire a
Hard to
nanny,
get
right?
you in a good
Yeah.
job.
So, and there are multiple things, and headaches and sleep and other things are like a completely other
It can be
workshop.
overwhelming.
So
Okay.
we'll use that route to address those. But yeah, as far as getting out of the fire, I have people crawl in here sometimes, and
Oh,
I
wow.
tell them,
I'll bet.
in that situation, that's kind of what those things are for. And if you can't stand up and go to the bathroom, okay. Yeah, I never realized you got to get out of the fire. You just got to determine when that is. Surgery is another option, but let's see what we're doing. Of course, this graph is just showing where we are in comparison to other countries, and we have the most spinal surgeries, which is not surprising. And this is what it has done from 1990 to 2000. This is spinal fusion rates. So they went up 220%. But how successful are those fusions? How successful are those surgeries? That's what we really need to be asking. How many of those people require another surgery?
Yeah.
And Heather will let you know, because we got some good research from
Spine, the journal Spine, okay? So basically, it's regarding that last graph Dr. Marley just showed. All right, I'm gonna read you a couple little things here. Despite new implant technologies and surgical techniques leading to increased rates of spinal fusion surgery, the percentage of patients requiring further low back surgery after spinal fusion has actually increased since the early 1990s. So what they're saying is even though their technologies have apparently advanced and gotten better and better, their re-surgery rates are they're getting worse. People are needing a second, a third surgery, okay? So as the rate of spinal fusion surgery increases, so did the proportion of patients who later required another low back operation. Let's see. The use of spinal fusion surgery has increased dramatically in recent years, 220%, especially since the US FDA approved the cage devices for spinal fusions in 1996. However, recent studies have questioned the true benefits of spinal fusion. Results suggest that rapid growth of spinal fusion surgery has been accompanied by an increase, not a decrease, in the need of repeated spinal surgery. So even the Journal of Spine is saying, like, what we're doing is not working. And it's actually getting worse. So.
But I want this to make sense to you guys, and we see this all the time. So we have a joint, let's say we have this disc herniation, right? And they have a couple options. They could cut that disc herniation out, but the problem that created that disc herniation is still there, right? They could cut the back portion of these joints to create more space for that disc herniation, but the very thing that created that disc herniation is still there. Or what they can do is they can just fuse that segment, right? So it stops getting irritated, stop getting inflamed. But if we fuse one area of the spine, we got to make up that motion somewhere else. Okay, so it's just going to keep moving up, and we're just going to keep wearing and tearing other areas of the spine, and we see that all the time. And unfortunately, we have some patients that are fused from the upper thoracic spine all the way up to the base of their skull. Okay.
And usually it's repeated surgeries. So they started out fusing 2 segments, and then they fuse another, and then another, and then another.
So I'm not saying that it doesn't have its place, and there's some cases where it would be necessary. In the case of spinal fusion, if we have a dislocation or if we have a fracture, fusion's a really good option, okay? But we always got to ask, what are the risks of the procedure? You know, what are the costs? What are my expected outcomes? A question we always like and tell patients to ask their medical provider, especially for something like that, is can I interview 10 of your patients? Okay? And what does the research say? We just showed you what the research said. And what are your other options? And hopefully they can give you a ton of other options. And then we always want you to ask, is it correcting the cause of my problem, or is it just treating the symptom?
Can you actually interview other patients like that, though, because of HIPAA?
Probably not. But really what you want to get from that is, like, if I talk to 10 of your patients, would they tell me, yeah, go through the surgery, or would they tell me I would have never done it? So it just gets the doc thinking, like, I have to be honest with you, I only have 50% people who really think it worked. You know what I mean?
Okay.
And whenever you look at the safety of something, especially in our world as healthcare providers, you should really kind of look into what somebody pays in malpractice, right? That's going to tell you how safe it is. So they have actuaries that really determine what's the risk for something and determine a reasonable fee because of that risk. And I'm going to tell you that some of these surgeons, I mean, they're going to have malpractice premiums that are upwards of $100,000 a year. Okay. I paid more in car insurance than I paid for malpractice last year. And I don't have any tickets or back surgery. So here's that 3-legged stool again, okay? So the adjustments in rhythm, like we said, every correction that we make on your spine builds on the one before it. So we need to stay in a rhythm. Bad habits, and we need to work on these exercises. So we talked about corrective care and rhythm, and that's what we do here. So let's get into some of these bad habits, because I know a lot of you guys are doing some of these, so we want to equip you. We want you to be mindfulness, we want consistency, and really what it comes down to is how are you sitting, how are you standing, and how you're sleeping. Okay, so if you continue to do what you've been doing, guess what you're going to continue to get?
What you get.
What you've been getting. And we'll talk about these exercises. When we focus on exercises, we want them to be functional, we want good technique, and we want them to have a purpose, right? We want to train movements and not necessarily muscles, right? So there's things you guys are doing from day to day that we can actually train for, okay? It might be picking our kids' toys up off the floor, or putting a kid in our crib, or carrying a car seat, or whatnot. We can actually train movements like that so we don't injure ourselves doing those day-to-day things. So, Breaking Bad. Now, we got some handouts out here on some of the ill effects of sitting. The typical person sits 13 to 15 hours a day. So we need to focus on our posture and our workstation, which we'll get into. And if we're on our feet, we want forgiving surfaces, guys. We really live in a concrete jungle. So we're literally wild animals in captivity, and we do not have a forgiving surface. We need to talk about our sleep surfaces, because you guys always ask me, that's like the most common question, how should I sleep? And does it really matter, because when you wake up, are you in the same position? But there is a position you should try and go to sleep in. We want to lift with our hips, okay? We always were taught that we should lift with our knees, and really everything should come from the hips. We might have to bend our knees, but we want to lift with our hips. And we always want to think about supporting these spinal curves. And one thing, especially for people like hairdressers or that have a workstation, they might do a lot of this, okay? Or if they're in a factory or whatnot, we always want you to point your feet to where you're going. Now, I don't want you guys to be robots by any means. I mean, you don't have to do one of these numbers, but just point your feet before you go somewhere, okay? So don't just turn your spine. Point your feet and then go that direction. So a few of these things that you guys are constantly asking about. As far as car position, here's what we want, guys. We always want a neutral spine, okay? No matter what we're looking at. Neutral spine to support those curves. Your steering wheel you shouldn't be doing the low riding thing, okay? So we're taking the normal curve out of the low back when we do that low ride deal. So we want our seat up 90 degrees. We want to be sitting up. We want our steering wheel fairly close, just to where we can grab it at 90 degrees. When you get in that position, you should look in all your mirrors and set them there. So then when you can't see out of your mirrors, you know that you're starting to slouch, and that's your cue to sit back up. If you get to a point when you're driving, if you're driving a long distance, where you're sore and your muscles are fatigued out, what do you think it's time to do? Stop, get out and walk around. Walk for a few minutes and then get back in the car. So, same thing with our workstation, okay? We want to be sitting upright. We want everything at 90 degrees, okay? So your knees at 90 degrees, your hips at 90 degrees. You guys know what I mean when I say 90 degrees? So hips at 90 degrees, knees at 90 degrees, upright spine, and we want our chin, our ear up over our shoulder, okay? We want our workstation, we want our computer directly in front of our face, okay? We don't want to be looking up, we don't want to be looking down. Now, for most of you, holding an upright posture is uncomfortable, okay? You start to get tired, things start to get sore. So when that happens, what do you think you should do?
Keep doing it until it doesn't make you sore anymore.
Or get up and go to the bathroom, get a drink, okay? Get up and walk around until we can really
Make it
retrain
burn.
those muscles.
Make it burn, basically.
That's what I feel.
No pain, no gain, right?
Right.
Okay, and
That's
this
not
is what our
gonna-
posture should look like. So when you're just going about your daily activities, you guys have to be more conscious of your posture. Okay, we don't want any of these. Okay, we want our ankle to line up with our knee.
I want to know how that first guy walks.
That's such an oversaturation.
Hey!
He's good though.
Yeah.
Sway back.
So what we want is everything from the ankle to the knee to the hip to the shoulder to the ear to line up in a straight line. Okay, that tells us that we're in good posture. And majority of us, we can at least just bring our shoulders back, right? And try and keep our head back up over our shoulders. Especially the kids. Sleeping position. Okay.
That's my life.
Oh, I saw that on YouTube. That was cute.
So traditionally, we want to keep the same principles, okay guys? Neutral spine. So one of the best ways to do that is on your back. So if we find a pillow where we can support that curve in our neck, and if we put a little pillow underneath our legs, we can help keep that curve in our low back. If we're unable to sleep on our back like that, or if we have other issues going on, your side is the best option. And in order to maintain that normal lumbar curve, you might have to bend your knees a little bit, maybe put a pillow between the knees. But what we're going for is we don't want a super soft bed or a pillow top where your spine is sinking into that thing, okay? So we're doing that. We want to support those curves, okay? So traditionally a firm mattress is going to be a little bit better for you guys. Now, in that discussion, just a little segue on workout, I said the most common way that we can damage these discs and damage the tissue around the spine is flexing at the spine, bending one way and rotating. So when we do a traditional crunch, and then we do a crunch with a rotation, do you think that's a good movement for the low back? No, we're doing the same thing that we're doing here, we're just in a different position. Okay, and we'll talk about that. So the traditional crunch, most people think I need to strengthen my core, I just need to do more crunches. No, if you do that, you're just going to destroy your discs. Okay? Lifting. So, we all heard that we need to, this guy is terrible. That is, I don't know if I've ever seen anybody lift that bad. But we want to bend at the knees, right? So when we're picking something up, guys, we want to think of like a squat at the gym, okay?
Yeah.
So we want to drop our butt, okay? And we want to come down and pick something up, and we want to come up with our hips, okay? We're not lifting with our knees, we're lifting with our hips. And we want to get that good extension. And we are going to make sure every single person in this room can do a squat, because it's one of the best exercises that you can do for your overall core and for stabilizing in your spine. Repetitive motions, guys. If you do any of this, whether it's bowling or it's golfing, every once in a while you got to grab a club and you got to swing to the other side, okay? Else you're going to create some major imbalances. Car seats. Okay, these things are like, I was going to say we should just call them subluxators instead of baby carriers.
For the moms or for the babies?
For the moms.
Okay.
Both, but mostly you guys.
Depends how much time your baby spends in it. But
So, unfortunately, you guys always do this one-arm thing, and usually it's going to be the same side. And same thing with like backpacks and slings. You need to...
I think it's a good town.
that is a nice tune.
We need to switch sides, but really when we're talking about car seats, you guys need to get those things up and closer to your body. So unfortunately, we recommend that you carry them like this, okay?
2 hands.
And you tuck them close into you. All right, so we can maintain neutral spine and still carry that thing.
And what do you do with all the bags and all that stuff?
I know it's brutal, but honestly,
Make
it
a second
is.
trip.
Yeah.
But yeah, either that or just you got to take the kid out of the car seat. And when we're talking about carrying kids, right? You all do this number. Yeah. Okay.
And usually on the same hip all the time.
So we need to constantly be changing our position. Okay. And same thing with the car seats if we're always using one arm. But yeah, it's best to just get the kid out of the car seat because that is going to contribute. Put that car seat not in the middle seat. Okay. Some of you guys are like, and then you wonder why you come in here and why your back still hurts. And I watch you just get adjusted, and then you're trying to put that car seat like in the middle of the
Wasted
seat
in.
on slippery ice and whatever. Vacuuming. Where is our vacuum? It's back there. So Heather will grab that vacuum. I'll show you the correct ergonomic.
Of course,
the
I'm gonna grab
vacuum.
that.
But right, majority of the time, what are we doing with the vacuum? We're bending, we're twisting, you know, and we have that same motion in the low back. And you wouldn't believe how many people that come in here that injured their back because of vacuuming. So try and switch sides, but I'm going to show you the ergonomically correct way to vacuum.
You just need to have a little more time to get it done.
And you need to have all your shades closed because your neighbors will make fun of you. But the correct way is you want everything to be at your center of gravity, right? And you're just going to walk like this.
Oh, that's perfect. I love that.
Hold it back up, and you come here, right? Your feet go where you need to go. But when we do what we're constantly doing one of these numbers, you are going to do damage to those discs,
I'm
okay?
staring back.
So neutral spine, and just walk where the vacuum goes. I know it's goofy. And like I said, everybody's
I
going to make
close my
fun of
doors
you.
too if I look like that.
But you can make fun of them when they're crippled over with low back pain. So when we talked about, you know, if you're a hairdresser or whatever, your feet need to go where your spine's going to go. Don't just turn. Here's just some random things, guys. The foods and the habits that we, our foods and our habits are make a big impact on this. So, if you smoke or if you consume tobacco of any kind, that nicotine actually has an effect on our blood vessels, okay? And we talked about how the disc has a real poor blood supply. The only blood supply it has is right around the periphery. But the effect that it has on those vessels, you're literally going to starve that disc of any nutrients that it's getting from those blood vessels. So we see an increase, the research, not just us, sees an increase in disc degeneration in people that consume tobacco. Doesn't matter whether you smoke or you chew tobacco or take it in some other form. Other pro-inflammatory foods, so really inflammation is a major player in here. We want to limit it. So things like dairy, sugar, and grains do promote inflammation. And that's a whole another workshop.
Are you gonna do a workshop on that by chance?
Yeah, we'll call it Inflammation Nation. Okay?
Cool.
So look out for it. Fish oil, they're high in omega-3s, so we can really create balance in that omega-3, omega-6 ratio and limit some of the inflammation. So a good omega-3 is good for overall.
Is there a minimum or a maximum you should take?
Yep. A
Okay.
minimum would be 1,200 milligrams. If somebody's on a therapeutic dose, it can be anywhere from 3 to 5 grams. So.
Okay.
And you want a
There's a lot.
good quality fish oil, one that needs to be
It can
refrigerated.
be a lot, but it depends on the situation for the person.
So how much fish oil do you get actually out of like a fillet of fish compared to like a tablet?
It really depends on the fish.
The cod or whatever.
So like if you have a nice 4 to 6 ounce fillet of salmon or something, like in general.
And you're gonna get the general recommended. You're gonna get over that 1,200 milligrams. But they have charged for that. I'll see if I can.
Yeah, that's a good question, Brandon, we'll look that
But
up.
it
Because I
depends
would
on the
much
fish.
rather eat the real thing.
Depends on the source.
But are you
No,
gonna
and if
eat
you do-
salmon
if
daily
you
though?
do,
Because are you
absolutely.
gonna get your 1,200
Yeah,
every
you
day?
eat salmon every day?
What kind of fish oil? Because I know a lot of the
Which
fish oil
husband
capsules
you
that you get at the stores, that fish oil can go rancid real quickly and you never know it because it's encapsulated.
Right. So
Yeah.
when you're taking a fish oil, first of all, if it smells like fish, it's been oxidized and it's gone rancid.
That's one good way to tell.
Yeah, or if you're having fishy burps. If
What
you're,
about freezer life? Does that help at all to preserve it maybe?
I wouldn't put it in the freezer, but you always want to put it in the fridge. Always put your fish oil in the fridge.
So what if it's not been in the fridge? My husband takes fish oil and I've never seen
Yeah,
it
I
in the
took
fridge.
fish oil to set on the counter.
Yeah, I
And
didn't
then
realize
here's
it was
the thing, and honestly, if you're getting a product from Walgreens or Walmart or Sam's Club, it's
That's
probably
what
not
it
a high
was.
quality fish oil.
Yeah.
So if you are bringing it in, we'll look at it. We'll
Okay.
tell you what.
They're advertising that omega-3 out there now that
Yeah.
mixes
my ice cream.
That's it.
oils from Antarctica or whatever.
What were you gonna say?
Generally, we want to get that from smaller
Yeah.
fish.
It's supposed to
seed.
have really high omega-3s and 6s and a good balance. You
Well,
can't
once
do
again,
fish.
I'll
You
have to
can
look into that one
allergic
for
to
you
fish,
too. Okay,
Or
hemp seed.
don't like.
Okay.
Yeah, I know.
Here's
I
the
know.
thing: when we get it from
I know,
other
that's the hard part.
grass-fed, grass-finished meats are also a good source of omega-3s, a good natural source. So if you're eating like deer and elk and other things like that,
Maybe the hemp seed is like it touts. It's like it's
the
Totally
problem
love
with the
tomatoes.
seeds
Okay,
is
I'll
it has to make one more conversion in the body to actually.
You can get oil too.
Mhm.
Hemp oil.
You can find it at natural grocery in any form. Hemp oil, seed minerals. You know, that's like one of the big omega-3s and
Yeah.
6s.
Okay.
So there is one more step the body has to go through to convert that to the EPA or the DHA that we really care about, and we'll address that in another workshop. But yeah, you miss out on a little bit there. So we always recommend it from fish. And then hydration is important. Guys, when you're doing stretches, we don't necessarily give you a specific stretch for the spine unless it's extension, okay? And we don't want you to bend at the waist to flex the spine, and especially not after an adjustment, okay? I have guys that are like, oh, that was good, and I'm like,
So
see you tomorrow!
Touching your toes is not a good idea?
So no touch.
Here's
Well,
the
it
thing.
depends how you bend.
Yeah, and everybody should be able to touch your toes, but I don't want you doing that for an exercise or a stretch. Okay? What I want you doing is focusing on your lower extremity. So our hamstrings, our quads, our glutes, all of those attach to the pelvis and have connections to the lumbar spine too. So let's just focus on stretching the lower extremity and not so much about the spine. Okay?
Does that make sense? So he's saying when we're doing this stretch to come down and touch our toes, we shouldn't be trying to stretch our spine. We should be trying to stretch
So
our
once again
legs.
there you'd be bending at the hips instead of the low back. So you can bend over and do that, but bend at the hips so we're actually getting a hamstring stretch.
Don't curl the low back.
Yeah, don't lock your knees, just bend your knees.
Well,
We can do a lunge.
No?
lunge.
Lunge.
Yeah, and we'll show you guys
Lunges?
some really, yeah, lunges are good.
Yeah, we're going to show you
Yep.
some good ones, assuming that some of you can stay. But yeah, we want you to focus on extension type of exercise, okay? So pushing back in extension, leaning into a wall, you know, where you can force those SI joints forward, okay? We don't get a lot of extension in our days, okay? We're at a computer usually like this.
Yeah.
So we're going to bring some extension into the spine. Most of you, we've given those life extension exercises where we do the YWTL. Those are also, everybody's giving me those.
Randy, I know you remember those.
Where's the T?
Shirley's doing the YMCA over there.
And I'll show you next time.
Can I just do this?
No. Okay. So exercises, guys. We have some specific exercises, and I can give you so many exercises under the sun. But we got to make sure that you got the basics down first. Otherwise, you're going to hurt yourself. And we can complicate these as much as we want. So the exercises that we want you guys to have down are these. We call them the big three. So it's the bird dog, the dead bug, and any type of plank variation. Okay.
Dead bug.
They got fun names, right? And all of those are going to focus on neutral spine, but you're still getting activation of the core. So we're gonna show you guys that, and you can progress with these and make them as hard as you want, assuming that you get them down. We got those life extensions, but we also want to give you functional movement. So squats, things like kettlebell swings or kettlebell carries, deadlifts, anything that involves balance. Each and every single one of you, I want to make sure that we can at least train you to where we can get a good start with a squat. It is super hard to master a squat. It's been almost breeded out of us, and if we still had to squat to go to the bathroom, we'd probably all still have a pretty good squat, but we can just flop down on the toilet now. Deadlifts also very, very important.
But then you get a squatty potty.
It can help you out there. So yeah, we want to make sure you guys know how to do a squat and a deadlift. Kettlebell swing is kind of a more complex movement, and once you get those other two down, you can do that. So that's really what we want to do now. So I want to kind of split you guys up and show you these big three, and then make sure that everybody